In 1952, the world was gripped by fear. Polio was everywhere. This merciless virus left devastation in its wake, killing or paralyzing around 500,000 people each year. Survivors were often left relying on wheelchairs, crutches, or even iron lungs just to breathe. Then, a miracle of science. Within a single decade, the US saw a staggering 96% drop in paralytic polio cases. That same pattern echoed around the globe. Hope surged. Could this be the end of polio? But the story didn't end there. As the 21st century dawned, polio began to make a disturbing return. Mysterious new outbreaks were popping up, despite decades of vaccination. Why? And more importantly, how can we finally eliminate polio for good? To unravel this mystery, we need to understand the virus's true threat. Surprisingly, most people infected with polio virus don't experience paralysis. In fact, fewer than 1% do. For the majority, it's just flu-like symptoms or nothing at all. That's what makes it so dangerous. Polio spreads easily, especially in places with poor sanitation. There are 3 strains, all transmitted through things as simple as a cough or contaminated water. And once someone is infected, they can silently pass it on for weeks without ever showing symptoms. This stealth made polio a force of nature, until Jonas Salk entered the scene. In the 1950s, Salk introduced the first inactivated polio vaccine, IPV. It was revolutionary. By injecting a killed version of the virus, it stopped all 3 strains from causing paralysis. But it had a downside. It didn't prevent the virus from living in the body or spreading. Enter Albert Sabin. Around the same time, he developed the oral polio vaccine, OPV. It was cheaper, easier to administer, and used weakened live polio viruses, what scientists call attenuated viruses. When swallowed, it not only protected the person but also blocked the virus from setting up shop in their body altogether. OPV's secret power? It could spread safely. It moved from person to person, immunizing entire communities, even the unvaccinated. For decades, this tag team of IPV and OPV helped country after country wipe out wild polio. Victory felt inevitable. Then came the twist. Around the turn of the century, researchers discovered something troubling: new, mutated strains of polio that were almost indistinguishable from the original 3. And the source? OPV itself. Here's how it happened. When OPV was used in communities with low vaccination rates, the weakened virus could circulate for too long, and over time it sometimes mutated, regaining its ability to cause paralysis. To be clear, OPV wasn't inherently dangerous. In fact, it helped eliminate wild type 2 polio virus and played a huge role in eradicating the disease from entire continents. But it needed wide-scale adoption, at least 80% vaccination coverage per community, to avoid mutation. So, how do we fix this? 2 strategies. First, scientists created improved vaccines. Monovalent and bivalent OPVs target 1 or 2 strains instead of all 3, lowering the chance of mutation. These next-gen vaccines have been crucial in tackling the last remnants of wild polio virus type 1 in Afghanistan and Pakistan. Researchers also engineered new OPVs, specifically to combat vaccine-derived type 2 polio virus, the current source of most polio cases in Africa and the Middle East. These updated versions carry minimal risk of reverting to harmful forms. Second, we've brought out the tech. Frontline health workers now use satellite imaging and geospatial tools to find isolated communities. Digital tracking ensures no child is missed. Even wastewater is monitored. Early warning systems scan for the virus before outbreaks spiral out of control. Now we're on the brink of something monumental. Wild polio virus is nearly extinct, and with the new vaccines, vaccine-derived strains may soon follow. But there's one major hurdle: access. War zones, political instability, and remote regions still prevent medical teams from reaching everyone. And if vaccination rates drop, even briefly, polio can silently make a comeback. That's why this moment is critical. We've fought this virus for over 70 years. We're closer than ever, but only relentless effort, global cooperation, and community-wide vaccination can finally push polio into the history books. For good.